Okay, so just kind of walk through it.
Sure. So with your F setting on your handpiece, we're going to take a full face. The key with the full face is to be about 2 feet away from your patient. Okay, finding a good resting point on your left hand here. Square your patient up and snap your photo. Okay, and that's your full face, plain and simple. Now we'll adjust our focal setting here on our dial to a smile. We'll keep the same resting point. We'll rest 4 fingers right underneath the patient's lip, right in the cleft of the chin. Holding the handpiece, we're going to rest the handpiece right on our hand here. Go ahead and smile big for me. And we'll go ahead and snap that photo. One thing to consider, you want your camera lining up right with the middle of your patient. You may want to use 3 fingers or 4 fingers. Key is finding that good resting point. Okay. From this position too, we can go ahead and take our bottom arch shot. So go ahead and open. And we've got our full arch shot. And we'll take our arch shot just like that. Okay. So same resting point, we're bringing our camera up a little bit, we're still out of the mouth, and we're getting that lower arch shot. Alright, now we'll go ahead and we'll take our upper arch shot, we'll grab our camera like a pen or a pencil, we're still using the same setting, so S for smiles and arches. We'll go ahead and keep our same resting point with our left hand, we'll bring the camera up on about our 3rd knuckle, and we can get our upper arch shot. Alright, those 4 extraoral images, I like to do it with the patient sitting up. Whatever you want to feel comfortable with, whether you like the patient sitting up or leaning back. So now to go intraoral, we'll lean our patient back. At this point too, if we want to choose to use a barrier or a sleeve, we'll go ahead and insert our camera into the sleeve, push the camera all the way up to the top. I like to take my thumb. This is just a good tip when using any barrier. Just seal the barrier to the end of the camera by pressing your thumb on the head of the camera. We'll change our setting now to our 2T setting. Now we're good to go intraoral. We'll grab our camera like a pen or a pencil. I like to rest my hand around the patient's head. Resting a couple of fingers here on the patient's chin. Go ahead and open for me. And I like to use a good fulcrum with my 2 fingers, whether you fulcrum with your thumb and your pointer finger or in between your 1st and 2nd finger. Now you can get down here in the buckle. A good shot of where that buckle is, Brent. You can kind of see where we're resting that camera to get a couple molars. And as we come out of the buckle area, we can rest right on the opposing arch if we'd like to get a couple of premolars. And then this is a great position to go ahead and get a couple of anteriors, a couple teeth. Remember, 2 for 2 teeth.
So for the 12 shots, so we've done the face, the arches.
Yeah. Let's go ahead and we'll go back here and we'll do upper rights. Okay, so upper rights.
In between the cheek and the teeth. Okay.
Yeah, go right down there in the buckle. Do the upper rights.
Okay.
We'll come over here and we'll do the upper lefts.
Okay.
Okay. We'll flip our camera over. We'll go lower lefts. We're going to rest right in the palate. Right up in the palate there.
Right to the side of the teeth.
Mm-hmm.
Okay.
We'll go lower lefts, and then we can come out here. You close just a little for me. Okay, and we'll come over here and we'll do lower rights. And there we go, our 12 shots. Main key is whether you're using the 2 teeth or the 1 tooth setting, is just find a good resting point, whether you're down here in the buckle or whether you're on the opposing arch. Keeping your camera nice and flat as you go in on the right side of the patient's mouth to take the upper rights, on the left side of the patient's mouth to take the upper lefts, and then you're just flipping the camera over in your hand, still holding like a pen or a pencil, finding your good resting point, your good fulcrum, and go ahead and snap in your photos.
So this is all done, all those 12 shots, you're still staying with 2. You only go to 1 or macro when you're...
You know, I'd probably stick with your, your 1-2 setting would probably be the best, actually. Reason being, it's a little bit easier to get farther away with the 1 tooth. With your 2 teeth, it's a little tough to get a couple molars.
So when do you switch to 1? So you do S for smile and arches.
And then you can go to your 2 teeth for bis and anteriors, but for your 1 tooth to get molars. So 1's for your molars.
Okay.
Is the best way to do that. It all depends on the patient's mouth